All right. I know people are still floating in, but we'll go ahead and get started. Um, and I just want to say thank you so much for joining us this afternoon. My name is Race Vora. Today, we're going to be doing a press conference on behalf of California Poison Control System about poisonous mushroom outbreak that is going on in the San Francisco Bay Area and Monterey counties. Uh, I'm the medical director at the California Poison Control System Fresno Madera Division. I'm joined by my colleagues today who are going to be our featured experts. Dr. Craig Smolin, who is the medical director at the San Francisco Division of California Poison Control System. Dr. Cyrus Rangan, who's another one of our associate medical directors, and he's also a pediatrician and a toxicologist. And Dr. Giovanni Laird, a pharmacist who's a specialist in poisoning information and based at the Fresno Madera Division of California Poison Control. Well, as you may be aware, since November 18th, there has been an outbreak of wild mushroom poisoning in the Bay Area. The poisonings have been linked to something called the death cap or Amanita mushroom, which we will talk more about in just a little bit. A lot of partner agencies have come together to respond to this outbreak, and today we wanted to take the opportunity to share the actions that have been taken and some of the actions that we're urging the public as well as healthcare providers to help us with in order to help respond to this outbreak. So with that, I'm going to ask Dr. Craig Smolin to just recap. Craig, you were the one that first recognized that we had a pretty severe outbreak this year of the mushrooms. Can you just generally summarize the clinical cases that we've known about so far through poison control?
Thanks, Dr. Vora, and thanks for the introduction and for you all being from the media being here. I'm happy to give an update with regards to this specific outbreak. To date, we are now aware of 23 total cases. The earliest case was reported to California Poison Control System on November 18th, and the most recent cases occurred over this past weekend, with the most recent case reported on December 6th. The patients have ranged in age from the youngest was 19 months old to the oldest of 56 years old. All of these patients were involved with independently foraging the mushrooms from the wild. They did not purchase these mushrooms from a store or a farmer's market, restaurant, or some kind of roadside vendor. They all developed symptoms within the first 24 hours, including nausea, vomiting, diarrhea, and abdominal pain. Most of the patients have now actually been discharged. However, we are still following 5 patients that are currently hospitalized. In total, in this particular outbreak, there has been 1 death, 1 patient who has received a liver transplant, and 1 patient who has been listed for a transplant but has not yet received one. Actions that the Poison Control Center has taken already to address this outbreak have included working with our partners at the California Department of Public Health to release a health alert to all of the healthcare providers across the state of California. We have tasked our own education group with developing press releases, education materials, and a webpage targeting communities at risk, including translating those materials into multiple different languages. We have arranged for this press conference today to inform you all as best we can of this outbreak and to make ourselves available to answer some of your questions. And that is the bird's eye view summary of what's been going on. And I'll let Race continue to lead us here.
Thank you. That's great. I know that you've been working tirelessly on this outbreak and in answering phone calls on our phone lines from clinicians as well as patients and families. Sai, can you talk a little bit just in general about poisonous mushrooms and specifically about Amanita mushrooms, which are the ones involved in this outbreak? And it looks like
There we go.
okay.
Sorry. Thank you, Dr. Vora and Dr. Smolin. I like to get just a little bit of an overview about poisonous mushrooms versus edible mushrooms. So this isn't a case of people getting into edible mushrooms that were somehow spoiled and turned into poisonous mushrooms. Out in the wild, there are mushrooms that are edible and there are mushrooms that are poisonous. And it's very, very difficult to tell the difference between the two. And we always recommend at Poison Control in our educational sessions and to the public that expertise is necessary to tell the difference between the two. We don't recommend that anybody ever go out foraging for wild mushrooms because it's so hard to tell the difference between an edible mushroom and a poisonous mushroom. There are many, many different kinds of poisonous mushrooms out there. Some are toxic to our gastrointestinal tract. Some of them cause kidney damage. Some of them cause muscle toxicity. Some of them cause seizures and convulsions. And this particular mushroom causes damage to the liver. This is called the death cap mushroom or the Amanita mushroom, and it's one of the most toxic mushrooms worldwide. It has a very sneaky kind of toxicity in that it tastes fine. It tastes like a regular mushroom, doesn't taste bad or spoiled. And patients usually don't have much in the order of symptoms for the first several hours after they eat it. So they feel fine for several hours. And then sometime within the first 24 hours after that ingestion, they start to get some severe problems that come from the progressive damage to the liver. So they'll get nausea, vomiting, diarrhea, or jaundice, which is yellowing to the skin. And it can be so severe that it requires extended hospitalizations. Now, in the hospital setting, we rely on the history and the physical exam of that patient to try to determine what's happening and what the patient needs. It's a very difficult mushroom to test for. There aren't a lot of standard tests that hospitals can use quickly to determine whether or not a patient was exposed to one of these mushrooms. And it's also very difficult to treat. We don't have a standard set of medications and medical interventions that are automatic that we give for these cases of poisoning. So we do our best with the tools that we have, but it's very difficult to treat. We hope that the patients are going to get better, but some patients go on to require liver transplantation, and a small portion of them, unfortunately, go on to die.
Thank you so much, Sai. I appreciate that very, very good summary. Naliza has very kindly shared a photo of this mushroom. And like you said, it doesn't really announce itself. It looks very nondescript, and that makes it such a challenge whenever people are out there foraging and then eating this with their meals. Craig, what should someone do if they feel like they're, at higher risk? What are some of the action steps that people can take if they feel like, okay, maybe they ate a mushroom or maybe they might be feeling a little bit sick? What are the kinds of things that we're advising over our phone lines and that we're sharing with our public health partners?
Yeah, thanks, Grace, and Sai. I want to just first emphasize that the single most important intervention that we have at our disposal here is to prevent the exposure in the first place. And that's the message that Dr. Rangan was mentioning about avoiding foraging unless you have incredible expertise in this area. But if the public is concerned that they have ingested a mushroom that may be toxic, certainly if they have any symptoms at all, they should present to an emergency department and be evaluated by a physician, someone with expertise, and they should provide that information that they were actually out foraging and that they're now having symptoms, or that they've actually ingested a mushroom and are now having symptoms. For patients who are asymptomatic, some of the resources, you can always call Poison Control at 1-800-222-1222 and talk to any of our specialists who can help guide you in whether or not to seek care. If you have ingested a mushroom, though, as Sai said, that is the Amanita phalloides, you may not have symptoms right away. And actually coming to the hospital earlier on, we at least can provide some treatments that may prevent the toxin from being absorbed. So if you are suspicious at all that you may have ingested one of these mushrooms, you should present early to an emergency department for evaluation. Either way, using the Poison Center as a resource, we are always available for you 24/7 to answer your questions about that.
Great, thank you. Sai, I'll let you close with some takeaway action items for both the public as well as medical providers. What people need to know about this outbreak to keep our community safe. And then we'll open it up to our media partners for question and answer. And also for anyone that needs Spanish language translation, we do also have Dr. Giovanni Laird, who can answer in Spanish for our Spanish-speaking media. Go ahead, Sai.
Sure. So just a couple of points to sort of summarize here. When it comes to poisonous mushrooms, once again, there are many different kinds of poisonous mushrooms out there. We get calls at Poison Control about poisonous mushrooms year round, but it's rare to see a large case series such as this Usually, when case series like this occur, it's because of people going out to forage. So it's usually a human behavior component that leads to something like this. So people foraging for wild mushrooms, not being able to tell the difference. So again, our overarching message is please, please, please do not go out and forage for wild mushrooms. It can only invite bad things when you come right down to it. These are almost entirely preventable exposures. So as long as you're getting your mushrooms from reliable sources like a store or a market, then you're going to be getting edible mushrooms. But if you go out foraging, you may get the poisonous kind. And be aware that these mushrooms can affect anybody. It doesn't matter if you're 9 months old or 90 years old. Anybody can be affected by these mushrooms, and it doesn't take very much, maybe even less than one mushroom, to cause extremely severe toxicity that may require hospitalization and may even require a liver transplant. So keep aware out there and don't go foraging, and get your mushrooms from reliable sources.
Great, thank you. We'll open it up for Q&A from our media partners. So please feel free to unmute yourself and ask questions. And I'll also try to follow along in the chat for those of you that want to type in your questions, and we'll try to moderate that way as well.
Thanks for being the best of us, Aaron.
Go ahead, Ricardo.
Oh, yes. Hi there. My name is Ricardo Tovar. I work with KSBW 8 News in Salinas, California, where we saw a good number of the outbreak. I just wondered, you attributed one death to this, to death cap mushroom consumption. Do you know what area that was in, San Francisco or the Monterey Bay Area?
I can't comment on the specifics of the locations at this time, but we may be able to share that information at a later date in conjunction with our partners at California State Department of Public Health.